Fix your hand after stroke with mirror and putty therapy at home. Hi friends, and welcome back to another educational video with Dr. Rehab. In today's video, I'm bringing you a set of simple and effective hand rehab techniques designed to support fine motor recovery and improve hand coordination. These exercises can be especially helpful for rebuilding strength in the tiny muscles we use every day for things like writing, picking up small objects, or buttoning a shirt. Simple tools, powerful results. If you're working on hand recovery, whether it's after a stroke or injury, you're in the right place. Leave me a comment and tell me, what's your biggest challenge with hand function right now? Like this video if you find it helpful. It really supports the channel. And don't forget to subscribe so you never miss the next rehab routine. Now let's begin the forehand exercises using putty and mirror therapy, demonstrated by a patient. Let's get started. We've positioned the mirror in front of the patient in a way that the healthy hand is visible both directly and through the mirror, while the affected hand stays hidden behind the mirror. This setup allows the brain to focus on the mirrored image of the healthy hand, creating the illusion that both hands are moving equally. In the healthy hand, we're using blue putty, which is a stronger resistance. In the affected hand, we're using red putty, which is softer and easier to work with. Now we ask the patient to squeeze the putty with the healthy hand while looking into the mirror, focusing on the reflected image. The goal is to create the illusion that both hands are moving and encourage the brain to re-engage the affected hand. If possible, the patient should try to mirror the movement with both hands at the same time, even if the affected side has limited motion. Exercise 2. For the second exercise, the patient places the putty on the table and uses the palm of the healthy hand to roll it back and forth. At the same time, they attempt to mirror the movement with the affected hand, even if the motion is limited. Because of the mirror setup, the patient sees both hands moving symmetrically, even though only the healthy hand is clearly in action. This visual feedback helps the brain reconnect motor pathways and promotes movement in the affected side. As many of you know, therapy putty comes in different colors based on resistance level, and I've already explained that in a previous video. Feel free to check that out for more details. Make sure to keep your eyes on the mirror and focus on your healthy hand during the whole exercise. Exercise 3. For the third exercise, the patient places the putty on the table and begins to press into it with the fingertips of the healthy hand. The affected hand attempts to mirror the same movement behind the mirror, even if it can't apply much pressure or control. Thanks to the mirrored image, the brain perceives both hands as working equally and effectively, which helps reinforce motor learning and boost confidence in the affected hand. This illusion of success is a powerful part of neuroplasticity, helping the brain rebuild lost connections through visual feedback. Exercise 4. In this exercise, the patient forms the putty into a bowl and gently rotates it in the palm of the healthy hand. The goal here is smooth, circular motion, not squeezing. It's about coordination and sensory feedback. Behind the mirror, the affected hand tries to follow the same movement. Even if it can't fully match the motion, the effort to reach it is what truly matters. In this video, the patient also applies some pressure while rotating. This isn't required, but it can help the putty hold its shape better during the motion. The mirrored image continues to give the brain the impression that both hands are moving equally, encouraging motor activity on the weaker side. This patient is really focused, but if your patient gets distracted, a simple cue can help bring their attention back. This combination of mirror therapy and graded resistance helps rewire the brain and support fine motor recovery in a functional, low-cost way. I recommend trying the previous putty exercises, but this time in front of a mirror. Let me know which ones you could mirror with both hands. Thanks for watching with love. See you soon.